So this is what I wanted our listeners to be aware of, is that a lot of times modern medicine just treats the disease. It doesn't treat the cause of the disease. So high cholesterol, high blood pressure, and diabetes are so common in America today and in the world today. And if you look deeper, the cause of this could be thyroid disease, which is easily treated. And there's dietary recommendations that Dr. Peat has described some of tonight that can help your thyroid health. And the medication is also fairly innocuous and safe to take. So can you tell us anything more about the interaction between the high blood pressure and the thyroid, Dr. Peat?
The toxemia of pregnancy or preeclampsia is one of the things that got me interested in how blood pressure is regulated by thyroid. It's very common, starting in the 1950s when the drug companies came out with their chemical diuretics. They told women that if they take their diuretics and restrict salt intake during pregnancy, that they'll prevent the high blood pressure of toxemia. And what they were doing was starving the developing baby of an adequate blood supply by reducing the blood volume. And they created millions of stressed, damaged pregnancies by restricting the salt intake. And the adrenaline rises when you restrict the salt intake, just as it does when you restrict the thyroid function. And so I noticed that premenstrual syndrome had many features in common with toxemia of pregnancy. And women were told to restrict their salt intake premenstrually. And because some researchers found that they could cure toxemia and bring the blood pressure down to normal by giving the women adequate amounts of salt and protein, I suggested that for premenstrual syndrome, women who get swollen feet and so on, try eating as much sodium as they crave. And sometimes that's a very large amount, maybe 15 grams a day premenstrually is what they crave naturally. And they found that it prevented their swelling feet and other symptoms.